I have a case of diastema closure. We will talk about it step by step. So, the first thing you need to know about diastema closure is the space. Here I had a relatively large space for diastema closure. It was about 3 millimeters, so between the central incisor. So, first thing I need to know or I need to do is to make a shade selection. So I have to select the shade within 3 minutes, because if I take more than this time, the tooth will dehydrate and it will appear whiter. So I have to make sure I will not exceed 3 minutes. I will use the bottom technique. As you can see here, I will use my composite shade and I put it on the incisal third for enamel composite, and for the cervical I will use it here for the dentin shade. Now, the shades that I selected was A1 and OA2 with these are packable composites, and this is flowable composite. Now, one of the tricks that is very important to do is before starting, without itching or bonding, you will use the composite shades that you selected as a mock-up inside the patient's mouth to close the diastema. It serves two purposes. First, the shade selection becomes better for you, and also you can show the patient the result before starting the procedure. Of course, you have to reassure the patient that the final result will be much prettier than this, but you have to show him something before starting. So you can do this by the composite as an immediate mock-up inside the patient's mouth. Next, I will use disclosing agent on the teeth before starting my work. Why? Because I have bacterial biofilm and food remnant. I will use this to clean the teeth. Why? Because if I don't remove this, it will affect my bonding procedure, my itching and bonding procedure. So I have to make sure I don't have any plaque or bacterial remnant on the teeth. Now, the first thing I will do, immediate silicone index. I will use a silicone and I will take an impression inside the patient's mouth to do my diastema closure. Here, my approach is to use an immediate silicone index inside the patient's mouth. Okay, now I will bring my blade, the number 11 blade, and I will use it to slice the silicone equally in half. And I will show you what we will do next. So when I slice and deepen the index, just like this, see this photo, just like this, I will do it equally on each side, and I will use this area for my palatal shell. Now, how do I cut it and how do I deepen it? Just look at the video. I will use a red coated burr. I will use it to make sure of the speed is not too much. I will deepen the index, as you can see here, slowly and equally on both sides. Make sure it is slow and equal. Next, I will further deepen the index and also refine the inside of the silicone index to make sure that I don't have any irregularities on the silicone index. I will use this technique. This green coated burr is from Jota. Okay, now I have to clean the index from the residues, from the silicone residues that was created by the burr that I used. I will use a small ball of composite to clean everything and make sure that my silicone index is clean for my next work. After finishing that, I will check my index for depth, and I have to make sure they are both equally deepened. Okay. Now I go back to the tooth and I will use an abrasive disc for roughness to roughen the surface of the enamel and the area that I'm going to etch and bond. Why do I roughen it? Because I don't want any fluoridated enamel to remain and to have a better etching of the surface. Okay, I will use two reference points here and here, slightly away from the etched line here and here. Why? Because when I bond, I will lose the surface, so I have to make sure that I'm not applying composite more than the edged area because it will fail and it will shrink and debond and will stain later on. Here I used OptiBond, fourth generation. As you can see, when I apply my bond, my etched surface immediately disappears. So that's why I have these reference lines here. Now, I will use the enamel shade for my palatal shell, which was the A1. Now, I will reinforce the enamel shell. Here I have two enamel shells. I will reinforce the shells with dentin composite. I need reinforcement because I will make some corrections on these walls, just like you can see. And I will use two sectional bands here with a wedge to make my diastema closure. I will use it just like a class 2, back-to-back class 2. I fill one tooth, remove the band, and I will make the other band stay and fill the next one. Now, after finishing, here I have my reference points. I finished my composite layering here. Now, this is my final result. Okay, as you can see, I closed the diastema. I have these beautiful transitional lines here, and this is immediately after the work, and my papilla will come inside this triangle and fill the gap